As genetic counselors, we're here to help patients understand the genetic risk of cancer and also support them through the medical, psychological, and family implications of genetic disease. We provide education about inheritance patterns, genetic testing, patient resources, and privacy laws in place to protect patients. Along with an oncologist or nurse practitioner, we provide patients with their genetic test results. At this appointment, we help patients make informed decisions about cancer risk management that best meets their needs and treatment. We also help determine who else in the family may benefit from genetic testing.
In families with a significant history of cancer, it is most informative to begin testing with a family member who has had cancer. If genetic testing identifies a mutation in a cancer prevention gene, then other family members can be tested to determine if they also inherited the same mutation. If there is not a family member with a diagnosis of cancer available for testing, the unaffected patient will meet with a genetic counselor to determine the next steps. We test patients with a diagnosis of cancer as well as patients without a diagnosis of cancer. This discussion will include the risks and benefits of genetic testing and how results will affect cancer screening and prevention recommendations. The National Comprehensive Cancer Network provides guidelines to determine when someone should see a cancer genetic counselor. These are a few of those guidelines. Multiple family members have been diagnosed with cancer, particularly if the diagnoses came before age 50. Family members who have had breast cancer in both breasts. Both breast and ovarian cancer is present on the same side of the family. Anyone diagnosed with ovarian cancer, regardless of age. Anyone diagnosed with pancreatic cancer, regardless of age. A male with breast cancer in the family. In addition to breast cancer, family members on the same side of the family who have had prostate cancer, colorectal cancer, stomach cancer, pancreatic cancer, or endometrial cancer. One person diagnosed with multiple primary cancers. 10 or more colon polyps. Ashkenazi Jewish ancestry.
We all have cancer prevention genes. We are born with them. Everyone has 2 copies of each of these genes, 1 copy inherited from each parent. When both copies are working, these genes help prevent cancer. When 1 copy of a cancer prevention gene is not working due to an inherited mutation, the individual has a higher risk of certain types of cancer. The cancer prevention genes are responsible for the repair of certain types of DNA damage. Without a gene mutation, functional cancer prevention genes prevent uncontrolled cell growth, which leads to cancer. Mutations in these cancer prevention genes have been linked to an increased risk for multiple forms of cancer, most notably breast, ovarian, colon, uterine, pancreatic, and prostate cancers. Typically, cancers related to inherited gene mutations occur at younger ages.
People who learn about their inherited risk for cancer can take steps to lower their cancer risk. These steps include specialized screening. Those with an inherited cancer risk often start screenings at earlier ages and may be monitored more closely than the general population. Risk reduction strategies. There are many ways to lower the risk of getting cancer. These strategies are discussed on an individual basis and are determined by the level of risk and personal preference of the patient. Risk avoidance. Some lifestyle changes may lower an individual's overall risk of cancer. Making informed treatment choices. Knowing about an inherited genetic risk can help an individual make surgical decisions and other treatment choices.
Insurance coverage of genetic testing varies from one policy to another. Most insurance companies cover the cost of testing for patients who meet criteria for genetic testing. At the appointment, your sample will be collected and sent to a genetic testing lab. The lab that we utilize will determine out-of-pocket costs prior to starting the genetic testing, and they will contact the patient directly.
For more information about genetic counseling and genetic testing, or to see if you or a family member meet criteria, call 7444.